We're going to now move on to segment 5 and discuss strategies for collaborative practice. In this segment, we will discuss strategies that can ensure good communication and that it takes place. There are many different strategies described in the literature, so we will review just a few that are frequently used to help with teamwork in healthcare. Briefs are held for planning purposes, huddles that are used for problem solving, and debriefs that are used for self-reflection and process improvement. We'll now explore each of these in greater detail. As we go forward, keep in mind that although the team leader typically facilitates team events, any team member can request a brief, huddle, or a debrief at any time as the need arises. This is an example of shared leadership and will be discussed in more detail in Module 4. A brief is a 5-minute team meeting for organization or planning purposes, which can include a discussion of team membership and roles, who is on the team and what are their roles, clinical status of the team's patients, team goals and task distribution. What really should the team accomplish and how could we do that? Pitfalls and barriers, including issues affecting team operations, resources normally available that may be restricted for that day. A debrief is a short, informal exchange that is used as a process improvement tool, which can include accurate recounting of key events, an analysis of what occurred, reflection on why and implications for practice, discussion of lessons learned and how things will differ next time, and establishment of a method to formally change the existing plan. A debrief should not be about assigning blame or being judgmental. It is really meant as an analysis to establish what went well, what we can do to improve, and really how can we do that. Simply put, it's about what we're going to keep doing, what are we going to stop doing, and what are we going to start doing. Some key examples are procedural teams or ambulatory care teams who really want to improve their process and their care, team huddles, or even surgical teams. A huddle is a team meeting held to problem solve and develop a shared understanding, which can include a check-in where team members touch base. And this is a great opportunity to do what I talked about earlier, which is get to know each other, which is really important for communication, but also to discuss critical issues and emerging events, to assign resources, to express concerns. Some examples of these are medical home interprofessional team huddles or surgical team huddles. Let's look back and review our hallway conversation and think about the strategies you just learned. How could they be applied to this situation to improve the collaboration?
You remember Mr. Jones, right? My patient who was discharged recently. Look, he has polymyositis, and he was ordered by a infectious disease physician to go to a skilled nursing facility for 6 weeks and get an IV antibiotic for that amount of time. If he really needs the full 6 weeks of the IV antibiotics, I just don't know that this is really the best care process for him.
Well, look, here's a social worker. Perhaps she can help you with that detail of it.
Oh, you know what? That's great, because my patient just arrived. I'm going to need to go. But if you guys can figure that out and let me know, that would be perfect. Thank you so much. I appreciate that.
Sorry.
I've got to get to a meeting.
Great. I've got a patient and physician waiting for me, too.
Let's check our understanding. Which of the following statements is correct? Think about the strategies you just learned. What could be the best strategy to apply to this situation to improve the collaboration? Is it A, a brief, B, a huddle, or C, a debrief? If you picked option B, a huddle, you're correct.
Oh, well, I'm so glad we have these regular daily huddles, because I have a difficult patient today. I'm going to need all the expertise I have on this. Let's see, is Joan from social work going to be able to make it?
Well, she said she was going to come, but I know she's got meetings earlier, so she might be a little bit late.
Okay, well, maybe we just get started, and then when she shows up, we'll fill her in.
Good deal.
Okay, great. So I think you remember Mr. Jones?
Yeah, I remember him. Came in several times, and I remember talking to him on the phone. Didn't he just get hospitalized and moved to the skilled nursing facility?
Yeah, so our task today is to figure out what resources we have available to us to make sure that he continues to get the care that he needs. He was ordered to be in the skilled nursing facility for 4 weeks, but he needs to be on IV antibiotics for 6 weeks. So the two options I was thinking of is either to extend the stay at the skilled nursing facility for those additional 2 weeks, or to see if there's a possibility of putting in an urgent request for a skilled, a home health nurse who could come in for a couple of weeks after he's discharged and give those IV antibiotics from his home. But what do you think?
I think we should extend his stay at the skilled nursing facility. We just have to come up with a compelling argument for that.
Okay. I can look in his notes and see how they made the case for it the first time. Is there any particular information I should be looking for?
Yeah, you need to look for skilled nursing need, does he still need dressing changes?
Okay.
I remember he had trouble ambulating. So does he need physical therapy? You know, what I could do is contact the skilled nursing facility he's in and see if we can extend his stay there.
Okay, that would be great. So it sounds like that's a really good plan. We'll start with that, but I'd like to have a backup plan in case it doesn't work out. I wish Joan were here. I know she'd have some really good ideas. Do you know when she's expected?
I'd now like to talk about our key learning points. Many strategies exist, but briefs, huddles, and debriefs are most commonly used for healthcare teams. If you need to plan something, hold a brief. If you need to solve a problem, hold a huddle. If you need to reflect on process, hold a debrief.